This is Coach PDHPE with another Year 12 Core 1 video, Health Priorities in Australia. The key idea is 4, what actions are needed to address Australia's health priorities. And the syllabus I'm doing here is the Ottawa Charter, everybody's favourite. In a previous video I covered the first 3 dash points. You can find that video on YouTube or on the website. But for this video here, I'm going to be focusing on the very last dash point, the Ottawa Charter in Action, which is linked to the Student Learn To on the right hand side, which said you need to critically analyse the importance of the 5 action areas of the Ottawa Charter through a study of 2 health promotion initiatives related to Australia's health priorities. Now what I'm going to do here is I'm going to choose one health priority and give you an example of how to do it, and then give you a couple of suggestions for other health priorities that you could probably do in your own time. So the first one I'm going to start off with is the National Tobacco Strategy. Now this has been going on for a number of years, and it was just started up again in 2012 and will run to 2018. And it has a big overall key message, and that's to improve the health of Australians by reducing the prevalence or the number of people who are smoking and the problems that are associated with that, both health, social and economic costs, and also the inequity that smoking causes in the community. So that's the key message. So again, what is the National Tobacco Strategy? Well, it's in place because of these statistics, and they're not very good. That over 3 million Australians are still smoking on a daily basis, and a really staggering figure that surprised me, that 15,000 people die each year of smoking related illnesses in this country. That's a staggering amount if you think about it. If 15,000 people were killed in a national disaster in this country, it would be on the news for months on end. So 15,000 people is fairly significant, and the reason why this strategy has been put in place. Here is some more key statistics from the National Tobacco Strategy. I'm not going to read all this out except to highlight some of the key points. And that's still 15% of Australians are smoking on a daily basis. And some of the inequities when it comes to health in this country is that 45% of HSC people are still smoking, and also people from a low socioeconomic status are smoking at higher rates than the rest of the country. So by 2018, the aim of the National Tobacco Strategy is to cut the rate of smoking from 15 to 10%, and also half the amount of HSC people who are smoking. So get it from roughly 45% somewhere into the 20s is the aim of the National Tobacco Strategy. Now that was a lot of information that I just gave you there, but there's probably 3 key points that you need to remember. That is to reduce the prevalence. Secondly, reduce the costs or the burden of disease, which is a good term to use. And finally, it's all about reducing the inequities that smoking causes in this country. And that's particularly for 2 groups, HSC people and people of low socioeconomic status. Now, a key term to use here is from Key Idea 1, priority health issue. Now, lung cancer has been chosen as a priority health issue, and the National Tobacco Strategy aims at reducing some of the problems associated with lung cancer in this country. So if given any opportunity to use that term in your question, the marker would be having red ticks going all over the place. Now I'm going to have a look at how the National Tobacco Strategy uses the Ottawa Charter. Now the Ottawa Charter provides a framework so that the likelihood of health promotion being successful increases. So the theory says that if for health promotion to have the greatest chance of being successful, it should be based around the 5 action areas of the Ottawa Charter. Now, as I mentioned before, the National Tobacco Strategy has been running for some time now, and it has been successful, and the National Tobacco Strategy for many years has been based around these 5 action areas of the Ottawa Charter. Now, another key initiative of the Ottawa Charter is this idea of partnerships, that it's just not one group that's responsible for health promotion, but it's a variety of groups working together. And it has a key term, a fancy term called intersectoral collaboration. And again, the marker is going to like to see you use that key term. So if you can remember it, intersectoral collaboration, that would be very helpful. Now, some of the groups that do work together are all levels of government. You've got the Cancer Council that's involved. You've got GPs and community groups, which I'll mention shortly. You've got schools, PDHPE programs providing safe messages about tobacco use, and also media. They're very important in promoting safe messages about tobacco use. So let's get into it, talking about the actual Ottawa Charter, the 5 different action areas. And the first one I'm going to talk about is developing personal skills. So when it comes to developing personal skills, educating people is crucial. It's considered one of the most effective ways of lowering the rates of any health problem is educating people. Now, the ways this is commonly done is through warning messages on the packets of actual cigarettes, and they're actually, as you can see by some of these examples, they're fairly graphic, and the idea behind it is actually educating people about the dangers of smoking. Now, another way developing personal skills is done is during PDHPE programs in schools, and I'm sure from your time during years 7 to 10 PDHPE you'll remember your teacher talking to you about the risks of smoking, and they may have presented to you a diagram that looks something like that. So the next action area is creating supportive environments. Now, giving people the desire to stop smoking is one thing, say through a fancy advertising program, but what is just as important is providing people with support to help them give up, to start the process and also finish it off. Now, a couple of ways this is done is through websites such as this one from the government, www.quitnow.government.au, and it's just to give some people some advice and some tips about how to go about giving up smoking. Now, another way it's done is through no smoking in public places. That's a supportive environment, because one of the things smokers find difficult is being in public around other people smoking. So when these laws are in place, when these supportive environments about not allowing to smoke in public places, this assists smokers greatly. Now, the third action area is strengthening community action. Now, community groups in many areas of the country provide at-risk youths with mentoring programs that help give them life skills. And one of these life skills is actually some tips and advice on how to go about giving up smoking. Also, in many community groups, carers are given training on how to give strong anti-smoking messages to the people who they are providing often full-time care to. The fourth action area is reorienting health services, and I think this is by far the most difficult to talk about. Now, one of the ways this has been done with the National Tobacco Strategy is the government has funded a program where GPs are encouraged to talk to their patients about quitting smoking. And one small example of the way this has been done is the prescription pads on doctors' desks that they write out for their patients when they need a script. And it has a simple little reminder at the top of the script for the doctor to talk to their patient about smoking. That's just to start up the conversation, to hopefully start up the communication process between the GP and the patient about the dangers of smoking. Now, ongoing investment into programs such as this will become it more effective in assisting people to quit smoking. Finally, the last action area is building healthy public policy, and this is the easy one to talk about. It's all about one of the main features that it does is through taxation on cigarettes. Now, taxation on cigarettes is very, very effective in helping lowering the rates of cigarettes. This is a quote that came off one of the newspapers just recently. It will cost $7,000 a year to smoke a pack of cigarettes every day. We estimate that just as a result of this tax increase alone, around 800 million fewer cigarettes will be smoked in Australia each year, and around 60,000 people will quit smoking. Now, that quote comes from the Australian Council on Smoking. as you can see from a simple price rise in the pack of cigarettes, the number of people who will give up smoking. So that's a government tax that's been put on each packet of cigarettes. Also, just government laws are also put in place about where people are allowed to smoke and not allowed to smoke. So there's a couple of examples. You'll know about them. There's no smoking inside of restaurants and cafes, and also public places such as train stations. So that's the end of it. There's 2 examples for each 5 action areas of the Ottawa Charter for the National Tobacco Strategy. I hope you find that useful. There are lots of other examples you can talk about that have it in many of your textbooks. One of the is Beyond Blue in its fight against mental health. That is one of the ones I would suggest to my class certainly to use. That information is in your textbook. Again, I hope you found it useful. If you need further clarification, seek out your textbook or speak to your teacher. Thanks for listening.